So here's the deal. It's 9:46 a.m. I'm gonna just let the camera roll and flip it over um, until the doctor comes in. So hopefully it won't take too long. All right. In the meantime, I'm gonna be knocked out, probably sleep, waiting for him. Here goes. Oh, pretty good.
Tyron, yeah.
Oh.
Did you want to get up there?
No, it's fine. I was just laying back until y'all got here.
Whenever, if you're comfortable that way, that's good. Whichever way you're comfortable with. You look great.
Thank you.
And I saw you when you were in the hospital, remember?
Mm-hmm.
Yes. And then I got called from, is it Beaufort?
Mm-hmm.
Beaufort? Yeah, you were there, I guess.
Yeah, that Friday.
That Friday,
I think it's when you saw me when I first came in.
Yeah.
And everything was all out of whack.
Yeah, I know. I heard that and I was like, oh, bummer.
Yeah.
You had to come back, and he was having fevers. And then I called them back actually because I talked to Dr. Chaudhary that weekend and called them back Monday because you got admitted, right?
Right.
And I was like, okay, is he getting better? Is he having still fever? So if he is, then give this injection. But then they said you were nicely improving by then and you were having liquids by then. And so I'm like, okay, thank God.
Yeah.
Okay, and so you were seen by the gastroenterologist. And
that was this past Tuesday.
Right. Oh, as an outpatient too, or?
No,
you were still in the hospital, right?
It was out. I went to the
office. Okay.
To the office.
Okay.
Mm-hmm.
Who did you see?
Oh my.
You can't remember. That's fine.
Kelly. Dr. Kelly.
Dr. Kelly. Out there in Beaufort area.
Mm-hmm.
Okay. This past Tuesday.
Yes.
What did she say?
She, based on what I told her,
Mm-hmm.
because I told her that I was doing a lot better.
Mm-hmm.
My appetite returned.
Okay, good.
And I was having regular bowel movements and everything.
Mm-hmm.
All my systems pretty much returned to normal. I felt.
Good.
So based on what I was telling her,
yeah.
She said that she wanted me to kind of wean myself off of the sulfate and stuff because I wasn't having the indigestion and acid anymore. But once I start back chemotherapy, if I need to return to it, then do so.
Okay.
And then
Brian, Kelly Brilliant is a PA. I see their note. Yeah.
She had them draw my labs again to see what my levels were because when I got out of the hospital on Friday, they were like my white blood cells was at 2.65 and now they're at 6.4 or something like that. So all my levels kind of balanced out. My hemoglobin, I think, was still, she said it was a tad bit low at 12 point something.
Right. And you did take that fluconazole, the fungal pill?
Yes. That's the yeast.
Yeah, yeast.
Yeah, I ran out of that
and you're done with
Saturday.
It? Yeah, you're done with it? Good.
Yep.
So, so you're back, swallowing good. And you're taking the protonics though, right?
Yeah, I am, but I haven't taken it in a little while.
Yeah, I would probably stay on top of it, like, if it happens again, or, the acid reflux kind of. So what happens is if your acid is not really being suppressed and you have GERD, basically esophageal reflux, the esophagus is going to spasm.
Gotcha.
And then give you pain, discomfort, difficulty swallowing. So, and then you can have injury in the lower part of the food pipe, and it can get infected sometimes, especially when your counts go down with the chemo.
Right.
So, just stay on top of it. You can take the protonics, but hopefully you wouldn't need the sucralfate or any more antifungals and things like that.
Okay. So, did the lab work come back from today already?
Yes, let me go over that with you in a minute. I'm just finishing up what, reading what they said. Dr. Ruffolo is the gastroenterologist out there, Washington, and he's the one that kind of stabbed Miss Kelly Brilliant. Brilliant. And yeah, they said consider EGD if symptoms come back and when your blood counts are good. And coming back to your blood counts, it's good. Actually, I reviewed. I don't know why I said let me review. I reviewed, and they did come back up. They are looking much better. I mean, your hemoglobin is still kind of on the little bit lower side, but platelets are back to normal, and white count is good. Excuse me. Yeah, white count is good, and creatinine. Oh my goodness, somebody's really thinking about me.
Is that what they say when that happens? Oh wow.
Yeah, in our culture. Did you ever hear about it?
No, I haven't heard that one before.
Yeah.
I know, like when your hands itching or whatever, they talk about getting money or something. Or yeah. I don't know. I'm so sorry.
I think I just need to eat something.
Bless your heart.
Yeah, creatinine is good. It's so good. Your liver enzymes are a little bit elevated, and they were in the past, but they are better or kind of stable. I would say. Excuse me.
Gotcha.
All right, and your energy is good.
Yeah.
Okay, you look much better than the first time when I saw, because I know you were in the middle of getting a lot of stuff done when you were in the hospital. And are you still with mom?
Yeah.
Good.
She's outside in the car.
Okay. Cool.
And my dad is probably waiting for me over in the fusion room because he always is straggling behind. So
yeah.
It's hard to find me.
Right. Did we have to delay the treatment because of the hospitalization?
Yes.
Yeah,
I missed three single treatments. I was supposed to
yeah, you're planning to have on the 2nd actually, right?
Right, I was supposed to start this cycle Tuesday.
This
coming up Tuesday. But being that I missed.
Yeah, your last treatment was.
I missed 2 treatments. I may have missed 3.
Excuse me.
My last treatment was the Tuesday before Thanksgiving.
24th.
The 24th.
Bleomycin. So you got how many? 1, 2. Any problems coughing?
No.
Okay, no shortness of breath.
Mm-mm.
Okay, no chest pain.
Mm-hmm.
Okay. And you said eating well, no diarrhea?
No.
Okay.
Everything is
no pain issues.
good. Everything's great.
And how about yeah, I know you had that.
No, frosting bag. I still got that, and it's fine. Home health just came and changed it.
That's the right side, right?
Correct.
Right. Is it putting out a lot?
No, I mean, yeah, normal, regular. I empty it probably about 2, 3 times a day. Probably.
2 times a day, okay.
Yeah.
And no blood there?
No.
And you're able to pee well?
Yes.
Excuse me.
It's okay.
No blood in the pee as well?
No.
Okay. And do you have appointment to see a urologist? Or?
No.
No.
Mm-mm.
It was put in here, right? The tube
That's
was put in the VIR.
Mm-hmm.
So I guess we may have to make an appointment, or let's see when your last scan was. Yeah, your scans were back here when you were here before Thanksgiving.
Okay.
Do you
when
have
you say the scans, you're talking about when
the CT scans?
Okay, yeah, those were like during the week of the 9th through
Right.
the something.
Wondering if you have an appointment coming up with VIR to have it re-looked at?
They don't have anything put in there until February. that I'm aware of. Like, and I guess that's to remove it actually.
Right,
after the chemotherapy
February
process.
procedure, COVID testing VAR, February 12th. Yeah.
Yeah.
Okay, I think as I said, our concern was the tumor was obstructing, and your upper kidney part was dilated, so we didn't want to lose any kidney function. So we kind of went ahead and just a little bit elevation there, and now it's back to normal. So things like are probably shrinking, and then also the urine being drained by the tube, so it's not affecting the kidney function at all for now. So we'll revisit that.
Okay.
And then the treatment part is today. Excuse me. Dr. Chowdhury is out actually.
Yeah, they informed me.
They did? Okay.
Yeah.
So you got one cycle so far. That's it. You were supposed to get the day 16. 17, 18, 19, 20, 21, 24. Yeah, you got one cycle. I mean, several days of treatment, but one cycle.
Gotcha.
And then cycle 2 was supposed to be last week on the 8th.
It started on the last. Okay.
Yeah, it's supposed to be. Because this chemo goes on for 1, 2, 3, 4, 5 days. And then day 9 is, excuse me, bleomycin. Yeah, it's a different schedule.
Now that's something I was going to ask you too.
Yeah.
Because when I went to Vitamin My Chart, I could not find the actual medicines that I was taking as far as chemotherapy medicines. Is it in there or?
I'm not sure how it shows up on the. It may not be unless you look in the notes, because the treatment plans probably won't show up there.
Gotcha. So would it be printed on the after?
Yeah. So
after
you
visit?
Probably got the information when you first started on treatment about
each time I leave each day.
If about each day, I don't know if it would be on the after visit. You can probably ask them to write them on the after visit if they don't show up, because after visit only gives you like what you need to be taking at home.
Gotcha.
I'm just glad you're feeling better,
Yeah. And I just hope that does not happen again.
Yes, that's right.
So I know what to look for, and
well, but you have to again. It's an intense chemo, right? Mm-hmm. But you're young, and these kind of tumors respond very well. So we try to push the treatment as much as possible. But you may have these speed breaker stuff, bumps going forward too. So just be careful. Like if you experience anything like little fever or anything, just make sure you call and you get in touch with the doctors.
Gotcha.
Because we need to get on it very quickly and not let it get into complications that would hold you from treatment.
Gotcha.
So okay, I'm gonna listen to you.
All right.
Okay. And deep breaths. Again. Okay. You've been staying active?
Yeah, I do little things around the house, a little cleaning here and there.
Yeah, just listen to your body. You don't have to stress yourself, but also don't want to lay around and not do anything either.
And especially since I've been on the chemotherapy, my strength is even more.
Exactly.
So, but even when I was taking the chemotherapy, I was still doing pitter pattering.
Yeah. Yeah.
And when if I go out, I just make sure I got my mask and.
Yes, that's right.
Try to keep my hands washed and all that good stuff. and I forgot to bring the document in, but I have critical illness insurance with my job, and I was supposed to bring the paperwork in. It's out in the car.
Oh, you can drop it again, or
who
fax it.
Okay, who would I need to?
Janet Reimer, the nurse navigator. Yeah, you have the card for her.
I don't.
Okay, I'll give it to you. You can either fax or you can call her, or you can just bring it back and drop today. You know, if it is in the car.
Okay.
Yeah.
Yeah, it's in the car.
Yeah.
I can just walk back in here, and that way.
That would be because you're here anyways. You know. All right. Today you're gonna see Dr. Novato. He's one of our urinary or genitourinary oncologists as well. Since Dr. Chaudhary's on vacation, I'm going to bring him in. He's very nice talking to, and you will definitely like him.
Okay.
And I do have something for you though. Our fellows here are in the cancer clinic are doing a survey as to how COVID is affecting our cancer patients.
Okay.
Psychologically, their anxiety or their health perception wise. It's just a
So I got some
survey.
homework to do.
Well, it can do it in infusion actually.
Okay.
If you would like to participate, that'd be helpful for us just to kind of figure out if we can do anything better. Yeah.
Okay.
So appreciate that. Let me just put. I would need a consent from you to saying that you are willing to participate, and so I can take this part and give you the copy of it. Well, and you can take the rest of the paperwork to the infusion and do it while you're getting the chemo, basically.
Okay.
These 5 pages are just the consent saying that you agreed to participate, and it would be signed. Name here, sign here, date here.
Gotcha.
Mm. 12/17. And then I will take this part and I'll get you a copy. This is your actual survey questionnaire.
Okay.
You don't have to do the scale part. You can do this one, and just the scoring you can just ignore this part too, and then you will do scoring.
Okay.
You ignore, but the rest you do it. Okay.
Gotcha.
And then I will take
your notes.
Yeah. Okay, you can.
All right.
Here's the graph for it then.
Thank you.
Yeah, thank you. Thank you for
participating.
Yeah. I'll be back with him, okay?
All right. Thank you, Dr. Amar.
Yeah.